You've probably heard of Tadalafil, that little pill often associated with intimacy and performance. But what if I told you that thousands of men, and even some women, are now taking it every single day, not just for sexual reasons, but for something far bigger? What really happens to your body when you take Tadalafil daily? Does it boost your energy, help your heart, raise testosterone, or could it possibly protect you from serious diseases? The truth might completely change the way you think about this drug. And here's the kicker. There's one hidden effect of daily Tadalafil use that only appears after several weeks, and almost nobody talks about it. We'll reveal that secret in Chapter 7. And trust me, it's something you'll want to know before ever trying this medication. When people hear Tadalafil, their minds usually jump straight to one thing: erectile dysfunction. It's often lumped together with Viagra, and while they're in the same family of drugs, they're far from identical. So let's clear up one big myth. Tadalafil is not just a sex pill. It's a medication developed for vascular function, originally designed to help men with an enlarged prostate, benign prostatic hyperplasia, and later approved for daily use in both ED and BPH treatment. Its superpower? Tadalafil works by relaxing blood vessels and improving blood flow, not only to specific parts of the body, but potentially to the entire circulatory system. Compared to Viagra, Tadalafil has a much longer half-life, up to 36 hours, can be taken once daily in low doses, usually 5 mg to 5 mg, has a more gradual, less spiky effect, making it easier to integrate into daily life. But here's the interesting part. Researchers soon discovered that its effects went beyond sexual performance. They began noticing changes in blood pressure regulation, inflammation markers, physical endurance in certain patients. This opened the door to off-label interest from doctors, athletes, and even biohackers looking to explore its benefits beyond the bedroom. Pattern break. Here's something most people don't know. Tadalafil was almost approved as a treatment for high blood pressure and heart failure. But then, Big Pharma realized there was way more money in the lifestyle market. So the drug's image was shaped around intimacy, not health. Think about that. And that image stuck, even though Tadalafil might have benefits far beyond what it's known for. Up next, now that you know what Tadalafil actually is, let's talk about what happens when you take your very first dose. Spoiler, you may feel something within the first 30 minutes, or nothing at all, and both responses tell us something important. So, you've taken your very first dose of Tadalafil. What now? Within 30 to 60 minutes, most people begin to feel subtle shifts in their body. But here's the catch. Tadalafil doesn't work like a stimulant. It's not caffeine. It doesn't kick in with a buzz. Instead, it opens blood vessels gradually, like turning a faucet, not flipping a switch. The most immediate effect is vasodilation, meaning your blood vessels widen slightly. This allows for smoother blood flow, especially in areas rich in vascular tissue. You may notice a feeling of warmth or flushing in the face or neck, a slightly elevated heart rate, mild nasal congestion, yep, that's blood flow to sinus vessels, enhanced sensitivity or circulation in more intimate areas, or nothing at all, and that's normal too. Here's why. At low daily doses, 2.5 mg to 5 mg, the goal isn't instant results, it's cumulative effect. Think of it like gradually improving your cardiovascular flexibility over time, not delivering a sudden jolt. Break-in pattern. A quick story. One man in his late 40s took 5 clears of Tadalafil daily for 3 weeks. At first, no change. But by week 3, he noticed easier urination, fewer nighttime bathroom trips, more morning energy, and yes, stronger, more spontaneous responses without timing the dose. It wasn't about performance. It was about vascular readiness. Key insight: if you don't feel anything on day 1, don't worry. The real question isn't what happens in 30 minutes. It's what transforms after 30 days. And that leads us to a big one. Why would anyone want to take this pill every day, on purpose? That's exactly what we'll explore in Chapter 3. The answer might surprise you, especially if you think this drug is only for older men. Now you might be thinking, wait, why would anyone take Tadalafil daily if it's just for occasional performance issues? Well, here's the truth. Daily Tadalafil isn't about performance. It's about prevention. Let's break it down. 1. Medical reasons for daily use. Doctors prescribe low-dose Tadalafil, usually 5 mg, for 2 main conditions: erectile dysfunction, ED, daily use helps men regain natural, spontaneous function without the need to plan around the pill. It reduces performance anxiety and improves blood flow over time. Benign prostatic hyperplasia, BPH. This condition affects up to 50% of men over 50. Tadalafil helps relax the muscles of the bladder and prostate, making urination easier and reducing nighttime trips to the bathroom. But here's where it gets even more fascinating. 2. The off-label reasons. More and more men are using Tadalafil daily not because they're sick, but because they're smart. These off-label benefits are gaining serious attention: improved circulation, reduced blood pressure, enhanced physical stamina, faster muscle recovery, mood and confidence improvements, even better sleep in some anecdotal cases. Athletes, executives, and biohackers have started to explore Tadalafil as a tool for vascular performance optimization. But here's the twist: not everyone responds the same way. Some men report feeling amazing, stronger, more energetic, more confident. Others, headaches, congestion, no noticeable benefits at all. It's not a one-size-fits-all solution, and that's why Chapter 4 is crucial. We're about to explore how Tadalafil interacts with your heart, blood pressure, and cardiovascular system. And the truth might make you think twice about self-prescribing this pill. You've probably heard that Tadalafil improves blood flow. But what does that actually mean for your heart? Is it helping, or could it be harming? Let's unpack that. 1. Vasodilation, the heart's best friend, or hidden threat. Tadalafil works by inhibiting an enzyme called PDE5, which causes your blood vessels to relax and widen. The result? Lower vascular resistance, easier blood circulation, and reduced strain on the heart. In fact, studies show that daily low-dose Tadalafil can slightly lower systolic blood pressure, especially in men with mild hypertension. Some research even suggests improved endothelial function, the health of the vessel lining, reduced pulmonary artery pressure, important in certain heart conditions, better oxygen delivery during physical activity. Sounds like a win, right? But here's where things get tricky. In people with certain cardiovascular conditions, the same vasodilation can backfire. For example, people on nitrates, like nitroglycerin for chest pain, can experience dangerous drops in blood pressure. Those with unstable heart conditions or arrhythmias may experience dizziness, fainting, or even cardiac events if the heart can't handle the shift in circulation. That's why Tadalafil is strictly contraindicated for patients using nitrate medications. Pattern break. Did you know? A clinical trial in Europe once tested Tadalafil as a treatment for congestive heart failure. Initial results were promising, but funding was pulled. Why? Some experts believe the market for sexual health was simply more profitable. Bottom line, for healthy men or those with mild hypertension, daily Tadalafil may offer mild cardiovascular benefits. But if you have heart issues, self-medicating is extremely risky. This is not a supplement. It's a prescription medication with serious vascular effects. And that leads us to an even more misunderstood topic. Can Tadalafil change your hormones, like testosterone or mood? That's exactly what we'll uncover in Chapter 5. There's a persistent rumor online that Tadalafil can boost testosterone. But is that fact or fiction? Let's dive into the science and separate real hormonal shifts from internet hype. 1. Does Tadalafil increase testosterone? Surprisingly, yes, but indirectly. Several studies have shown that men taking Tadalafil daily, 5 mg, experience modest increases in total testosterone levels, especially if they had low levels to begin with. Here's how it works. Tadalafil improves sleep quality, and sleep is where most testosterone production happens. It reduces inflammation and improves blood flow to the testes. It helps normalize the hypothalamic pituitary gonadal axis, which controls hormone production. In one study, daily Tadalafil users saw a 10 to 15% boost in testosterone levels after 12 weeks. Now, it's not enough to replace testosterone therapy, but it can help support natural production, especially in men over 40. 2. What about libido and sexual confidence? Tadalafil doesn't directly stimulate libido, but here's where psychology comes in. Daily users report increased confidence, more spontaneous desire, less anxiety around intimacy, a stronger sense of readiness. And as you know, confidence alone can significantly impact mood, performance, and even hormone levels. 3. Can it affect mood, positively or negatively? Here's where it gets complex. For some men, daily Tadalafil use is linked to better mood and mental clarity, reduced symptoms of mild depression, increased motivation and energy. But in others, the pressure to perform every day can actually cause anxiety. Side effects, like headaches or nasal congestion, may impact quality of life. A psychological dependency can develop, not physical addiction, but the belief that they need the pill to feel normal. Pattern break. Real talk. There are men who say Tadalafil gave them their confidence and even their relationships back. But there are others who say it made them feel trapped, reliant on a chemical to feel like themselves again. That's why understanding the broader effects, like mood, self-perception, and hormone balance, is just as important as understanding the physical ones. Up next, we're going to uncover some unexpected benefits and hidden risks that go way beyond testosterone or blood flow. You might be shocked to learn how Tadalafil is being researched for inflammation, sleep, and even Alzheimer's. When most people think of Tadalafil, they picture one thing, but behind the scenes, researchers have been exploring a wide range of benefits that have nothing to do with sex. Some are promising, others a bit concerning. Let's break it down. 1. Anti-inflammatory effects. Tadalafil has been shown to reduce C-reactive protein, CRP, a marker of inflammation in the body. This means it may have systemic anti-inflammatory effects, which could play a role in heart disease prevention, insulin sensitivity, slowing age-related decline. In fact, some scientists are exploring it as a vascular protective agent, not unlike low-dose aspirin. 2. Cognitive function and Alzheimer's research. Here's a shocker. A growing body of research is investigating PDE5 inhibitors like Tadalafil as potential treatments for early-stage Alzheimer's and vascular dementia. Why? Because improved blood flow to the brain may enhance memory formation, slow cognitive decline, support neural repair. It's still early, but trials are underway. One mouse study even showed improved learning ability after long-term low-dose PDE5 use. 3. Better sleep? Maybe. Anecdotally, some men report deeper, more restful sleep on Tadalafil. This may be linked to improved oxygen delivery, reduced nighttime urination in BPH cases, lower evening blood pressure, but it's not universal, and some men report the opposite, restlessness or mild insomnia. 4. Athletic recovery and endurance. Among elite athletes and biohackers, Tadalafil has been used, off-label, to improve muscle oxygenation, reduce lactic acid buildup, support faster recovery after intense training. There's even speculation it could be a performance enhancer in high-altitude environments. Some Olympic athletes have discreetly used it for altitude training support, though it's not banned in low doses. 5. The risks nobody talks about. With daily use, some slow-burn side effects can creep up. Vision changes. Tadalafil affects enzymes in the retina. Long-term use may increase risk of color distortion or light sensitivity. Hearing issues. Sudden hearing loss has been reported in rare cases, particularly when mixed with other medications. Psychological reliance. As mentioned earlier, daily use can shift from support to emotional crutch. Pattern break. Did you know? In 2023, a biotech startup launched a clinical trial testing microdoses of Tadalafil as a daily anti-aging supplement, marketed not for sex, but for vascular youth. The idea? Keep your blood vessels as flexible at 60 as they were at 30. Sound crazy? Maybe. But the science isn't fiction. Daily Tadalafil can feel like a miracle at first. Better circulation, confidence, maybe even stamina. But over time, certain side effects can appear so gradually that many people don't notice until it's too late. Let's shine a light on what could be happening behind the scenes. 1. Vision changes, subtle but serious. Tadalafil affects PDE6, an enzyme found in the retina. This can lead to blurred vision, increased sensitivity to light, difficulty distinguishing between blue and green hues. For some, these changes are temporary, but for others, especially those using the drug long-term, these subtle effects can become persistent. In rare cases, there's a condition called NION, non-arteritic anterior ischemic optic neuropathy, where blood flow to the optic nerve is impaired. It's extremely rare, but serious. 2. Hearing loss, a hidden risk. Yes, this is real. Sudden hearing loss, ringing in the ears, tinnitus, or muffled sounds have all been reported with PDE5 inhibitors. In most cases, it's reversible, but again, when taken daily, the cumulative vascular impact on small vessels in the ear may raise long-term risks. 3. Chronic nasal congestion and sinus pressure. Tadalafil causes vasodilation, even in nasal blood vessels. For some, this leads to constant stuffy nose pressure headaches, difficulty breathing at night. Over time, this can disrupt sleep and lower quality of life, especially if it's mistaken for allergies or sinus issues. 4. Headaches and blood pressure fluctuations. As blood vessels expand and contract, some people experience mild to moderate headaches, dizziness when standing up, fluctuations in blood pressure, especially when combined with alcohol or other meds. Most people adapt, but for some, it becomes a daily nuisance. 5. Psychological dependence. This one is more common than people admit. Daily users may start to feel, I'm not myself without it. What if I stop and everything gets worse? Fear of losing performance or confidence. It's not a chemical addiction, but it is a cognitive pattern that can interfere with self-esteem and natural ability. Pattern break. The secret effect revealed. Earlier, we teased a hidden effect that emerges after several weeks of daily use. Here it is. In some men, long-term Tadalafil use can lower sperm motility and volume, a rare but documented side effect that may impact fertility. It's usually reversible after stopping the drug, but it's not something most people are told, and it could matter a lot if you're trying to start a family. After everything we've explored, the benefits, the risks, the science, and the stories, one question remains. Is daily Tadalafil right for you? Let's approach this the way a responsible doctor would, not with hype, but with real-world guidance. 1. Who should consider daily Tadalafil? Daily use might be appropriate for men who experience chronic erectile dysfunction, not just occasional, have been diagnosed with benign prostatic hyperplasia, BPH, have mild hypertension or poor circulation, under medical supervision, are under the care of a doctor who is monitoring side effects and progress. In these cases, daily low-dose Tadalafil, 5 mg can improve quality of life, support vascular health, increase confidence and spontaneity. 2. Who shouldn't use it daily? Tadalafil should be avoided or used with extreme caution. If you take nitrates or blood pressure meds that can interact dangerously, have uncontrolled heart disease or recent stroke, experience frequent headaches, vision, or hearing changes, are younger than 30 and using it purely for performance, and absolutely never take it without medical guidance, especially long-term. This is not a casual supplement. It's a prescription drug with systemic effects. 3. A doctor's take. Weighing the pros and cons. When prescribed correctly, Tadalafil can offer a life-changing improvement in both physical and emotional well-being. But when misused, or used indefinitely without supervision, the slow damage may outweigh the short-term boost. As one urologist put it, Tadalafil is a powerful tool, but like any tool, it depends on how and why you use it. Practical tips if you're considering daily use. Always start with a full health checkup, especially cardiovascular screening. Begin with the lowest effective dose. Watch for subtle side effects, especially in eyes, ears, and sleep patterns. Reevaluate with your doctor every 3 to 6 months. Avoid using it as a substitute for lifestyle changes, sleep, nutrition, exercise. Final insight: sometimes the real power of a medication isn't in what it does for you, but in how it makes you show up differently in your life. If you feel better, act with more confidence, and take better care of yourself. That matters too. We've covered a lot in this video, and for good reason. Tadalafil isn't just a performance drug. It's a powerful vascular agent that affects your heart, hormones, brain, and more. Let's break it down. What we learned. It works by relaxing blood vessels, improving blood flow systemically. It may improve urination, stamina, mood, and even testosterone levels. There are potential cognitive and anti-inflammatory benefits, but it also comes with risks, especially for vision, hearing, and dependency. Before you take it, every day, ask yourself, am I doing this for a real medical reason or for performance anxiety? Have I ruled out deeper health issues like diabetes or heart disease? Am I being guided by a doctor or by influencers? Practical tips for safe use. Start low, 2.5 milligrams, and only increase if advised. Track your side effects weekly. Take regular breaks to assess your baseline. Never mix with alcohol or nitrate medications. Remember, it's a tool, not a crutch. Emotional close. If this video opened your eyes or helped you make a more informed decision, share it with someone who needs to see it. Whether you're using Tadalafil for confidence, for health, or for prevention, knowledge is your best medicine. Final CTA, call to action. If you found this video helpful, hit the like button, subscribe for more science-backed health content, and drop a comment. Would you ever consider taking Tadalafil daily? Why or why not?